Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy in Perham, Minnesota, as well as Park Rapids, Minnesota. Today we're going to continue our 5 Best series. What this series is all about is me talking about what I believe to be the 5 best exercises for various areas of the body. The 5 best exercises that can be done at home safely, that can be done at home to help prevent common injuries, or to be done at home to help you get over some common aches and pains. So we've talked about the ankle, we've talked about the knee, we've talked about the hip. Today we're going to talk about the 5 best exercises for the low back. Now, if you've seen any of the other episodes that I have done, you will know that there are many reasons that people end up with low back pain. So it's actually quite difficult to come up with 5 exercises that are really good for the low back. However, we are able to do it. What you got to think about is what can be the source of pain. So you can have pain that comes from the disc, you can have pain that comes from what's called the SI joint. So you just want to get an exercise package that kind of covers everything. So what we're going to talk about today is we're going to talk about one exercise that's really good for the disc. We're going to talk about one exercise that involves stomach strengthening. We're going to talk about an exercise that involves low back strengthening. We're going to talk about an exercise that keeps the joints of the low back mobile. And then we're also going to talk about one exercise that keeps the piriformis muscle flexible. Now, the piriformis muscle is a muscle that sits right on top of a nerve called the sciatic nerve, and that's a very common source of pain in the low back. So you really want to work on keeping that muscle mobile. So let's hop right to it and we'll talk about those exercises. 3 of them will be done laying on your back. 2 of them will be done laying on your stomach. Now, what's nice about all the exercises that I choose, there are thousands of exercises out there, but what I try to do is I try to choose exercises that are safe to do and that any age group can do. So we'll talk about the 3 that you can do on your back first. So I'll go ahead and lie down. So the first thing we'll talk about is the stomach. When it comes to low back issues, you really want to maintain good stomach strength to help support your spine. So one exercise that you can do for the low back to really try to engage all of the stomach muscles is the following. So what you want to do is you lie on your stomach with your knees bent, and you want to suck your stomach in. And the way that I usually describe it is you want to think about taking your belly button and trying to scoop your belly button up and under your rib cage as you kind of just tighten up the stomach. Now, you're not going to see me do it, but I am doing it right now. I'm tightening up my stomach. I'm thinking about that belly button coming up and underneath my rib cage. Now, you want to maintain that nice firm contraction. Raise one leg up. Raise the second leg up as you're maintaining that contraction. And then you also want to lift your shoulder blades up. Now, if you have some neck issues, you can use one hand to help support your head. And then from here, you just hold this position, and you kind of wave your arm as many times as you would like. Now, typically, I'll tell people to do that between 25 and 100 times. So it's tighten, lift, lift, and wave the arms. So that's a really nice exercise for the lower abdominal or the stomach muscles. Second thing you can do on your back is you can stretch out that piriformis muscle. The easiest way to do that, and the safest way to do that, is to cross one leg over the other. So you're going to take, in this case, I'm going to take my right ankle, place it on my left knee. I'm then going to grab my right knee, and I'm going to pull my right knee right towards my opposite shoulder. So I'm going to bring that right knee and pull it right over towards my left shoulder. And I'm going to feel a nice stretch right through here, and that's right where the piriformis sits. Now, when you do a stretch for the piriformis, you want to hold it for about 25 seconds, and I would do 3 to 5 stretches, obviously on both sides. Okay. All right, and the final exercise you can do while you're lying on your back is to keep your joints of the spine mobile. You want to rotate the joints of the spine. Now, what I'll usually recommend is you get into this position. So one leg is straight, other leg is up in the air. You take one hand and you rotate your hip over the top, keeping, hopefully you can see this, but my shoulders are both on the ground, are still on the ground. So I'm getting a nice rotation into my low back. And again, I'm going to hold this position for about 25 seconds and do 3 to 5 of them. I'll show it on the other side. One leg stays straight, the other hip comes up, and you just rotate. We're getting a nice rotation in our low back. Okay. Now, 2 exercises that we can do lying on our stomach. One is for the disc, and the other is for maintaining really good low back strength. So I'll show you the disc one first. You've probably seen this before if you've watched any of my other episodes. This is very, very healthy for the disc. It keeps the disc bathed in fluid. So what we do, I just call it a sloppy push-up. It's also called a prone press-up. You want to keep your hips down. You get into the push-up position, and you raise your upper body, keeping your hips on the ground. And you just repeat that. You don't have to hold it for any length of time. You just repeat it. Typically repeating it 10 to 15 times. The final thing that's really, really important is maintaining good muscular strength. There have been phenomenal studies out there that show that if someone has a back injury, they recover from the back injury. If they do not strengthen one particular muscle, there's an 80% chance that they're going to have a back injury again. So it's really important that we strengthen the following muscle. The easiest way to do it, lie flat on your stomach, and what you do is you just raise your chest up, and that's really going to engage the muscle right where my hand is. It's called the multifidus muscle. And you just hold that position for 30 seconds, and you do 3 of them. And that will really help strengthen the low back and prevent reoccurrences of injuries. If you do these exercises and the pain does not go away, or if you increase your pain, please give me a call. My number is 218-346-2464. Thank you very much for watching.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.